mental health conditions. And we know from the evidence that there's increased psychiatric hospitalisations, higher mortality among people with mental illness, and heightened suicide rates as a result of these of climate change and related extreme events. However, compared with other health areas, social and emotional wellbeing or mental health or whatever definition of psychological wellbeing we want to use, and climate change have received little research attention. We're really behind the game, particularly in the context of rural and regional communities, who are often the ones most directly impacted by climate change. Next slide, please, Liz. And just to highlight that the links between mental health and climate change are really complex. There's our direct impacts, which we might know of, trauma related to bushfires and flooding, etc. But really this issue cuts across all sectors, across a whole system of which the causal pathways and associations are operating. And that's really important to note. Not necessarily the details of this figure that I'm showing today, which was published by Helen Berry some years ago, but really just to appreciate that it is across a number of areas of society that these impacts of, or links rather, between mental health and climate change are operating. And that's very important for today's conversation in terms of why would we need a transdisciplinary approach to solving some of the issues that we're seeing. Next slide, please, Liz. So they're also multi-level. So I mentioned just then about the direct impacts, which are what we call primary level impacts. And these come from the events themselves. So extended heat, rainfall, fires, floods, storms. Those ones are probably the most obvious that when we think about mental health and climate change. Then we've also got our secondary or indirect impacts, which are to do with drought, which is a more chronic event, sea level rise, land degradation, air pollution. Physical health has strong links with mental health and is also impacted by climate change significantly. And also water and food security, which is impacted by climate change and has then impacts on mental health. And then we really get into these broad society level impacts where we're looking at displacement and migration, loss of connection to land, health system pressures and reduced access to mental health care, have reduced economic productivity, agricultural losses, reduced financial security, strain on community cohesion and social capital, loss of nature spaces, which we know are really important for maintaining our well-being and that connection to nature, and also conflict and political instability. These are all things that are operating on a societal level and are impacted by climate change and have direct links to population mental health. So with that very brief introduction to the mental health impacts of climate change, I'm just going to talk a little bit about the network, why we're here today. So the UQ, or University of Queensland Mental Health and Climate Change Transdisciplinary Research Network, which I know is a bit of a mouthful, so we've kind of put a bit of an abbreviation there, is the first transdisciplinary research network in Australia with an applied research approach to addressing the interconnecting social, mental and emotional health impacts of climate change. Our network specialises in mental health for communities impacted by climate change events, and it focuses on research, evidence and solutions, importantly. So we set up this network in 2019. It was really in response to the growing need of government and industry for an evidence base that supports the work that they're doing, whether that's a service delivery, so interventions, tools such as assessment tools or policy, which are required to protect the social emotional wellbeing of our populations. we really wanted to, we acknowledge the need to coordinate and expand research activities with university and industry or government community partners. We really wanted to harness the transdisciplinary expertise across UQ and more broadly, which I'll talk about in a minute, for greater innovation and impact. And it was really about bringing together a critical mass of research within this growing area of concern. Our vision, or the network's vision, is to secure the social emotional wellbeing of rural and regional as a focus, but more broadly across all populations and communities in Australia in an age of rapid environmental change. In pursuing this vision, we really anticipate that UQ's Mental Health and Climate Change Network will become a national hub of expertise for the social emotional wellbeing aspects of natural disasters or extreme events related to climate change. So who are we? These are our UQ researchers and, very importantly, PhD students who are currently conducting and engaged in research within across UQ. And you can see there we've got we do have a very broad representation of skills and disciplines. So we have School of Public Health, which I'm from. We have researchers from 2 of our social science departments. We have researchers from the School of Earth and Environmental Sciences. We have people from Communication and Arts, the School of Business, Biology. So really economics, importantly economics. So we've got a really broad representation and a really nice complementary skill set of researchers who can tackle the issues that we're seeing and the research questions that are being asked around mental health and climate change. So they're our UQ researchers, but what we are doing more and more, and it is one of the reasons that we are holding this webinar today, is to extend our collaborations across other institutions, both nationally and internationally. And we have 2 researchers on the panel today who I will introduce in a moment, who are from other academic institutions, and we are already engaged in collaborative work. So as we increase our membership and extend our membership out beyond UQ, acting as, and UQ would maintain a host role for the network, we're really committed to following activities that add value to our members. And we really want to connect and coordinate partnerships between field experts and academic experts to support this really important applied research approach to mental health and climate change. We want to position our members, both academic and non-academic, for strategic funding and investment opportunities, which we all know is an ongoing challenge, but an important one, so that we can continue to do our research and work. We want to support the development of proposals, which ties back into the funding. We want to share knowledge about mental health and climate change, so acting as a knowledge broker. We want to promote higher degree research opportunities within the network and beyond, and our PhD candidates and our ECRs are a really important capacity building component of the network. We need to develop more capacity in this space. We want to shape and influence the national research agenda for mental health and climate change, which has not been well developed yet. So we're in quite a unique position in time and place to do that. We want to advocate for the importance of research. And importantly, the most important, none of this makes any difference unless the research is translated into informing policy, service planning, etc., unless it's actually used by people. So how do we develop our research projects? We work very closely with external partners. We've been very, very busy in the last year or 2 developing relationships, having workshops, discussions with external partners to understand what it is that they need in terms of research that could support the work that they are doing. And broadly, there's sort of three categories of external partners, if you like. We've got the public sector, which are our government agencies, federal, state level, local level. We have our public purpose corporations, councils. Local councils are an important partner in this work, are very active in this work and have a lot of interest in this work, and also other state-owned enterprises. If we look at the private sector, we have got industry and other private corporations, philanthropic organisations, trade unions, some external partners. And then as individuals who are, might be academic researchers from other institutions, politicians we have engaged with in the past, high profile personalities with an active interest in the subject matter, and of course, students. And we have a few representatives from some of those partners on the panel today. Thanks, Liz. Okay, so let's get to it. Let's introduce our panellists. We have today a very a star-studded lineup of panellists, and I'm really grateful for their time. We have got Selena Gomersall, who is the Chief Advocacy Officer from Outback Futures. We have got Ben Norris as the outgoing manager of the Mental Health, Drought and Disaster team in Queensland Health. We have got Rebecca Patrick, who is the Director of Deacon's Sustainable Health Network and is a climate and mental health researcher who our UQ network actively collaborates with. We also have Collin Sivalingum, who is, I'm going to get this title right, sorry, Collin, he is the State Emergency Manager for the Australian Red Cross. Who have I got? Joe Longman, who is from the Centre for Rural Health at the University of Sydney, and that is in Lismore. So thank you to all of our panellists. I'm going to start with you, Collin. The Australian Red Cross has a huge amount of experience working to support communities impacted by extreme weather events, amongst other adversity. And these weather events are really increasing in intensity and magnitude, we know, as our climate changes. So what do you see as the most significant challenges faced by the communities that you work in, and how do you think research could support the development of solutions to these challenges?
Good morning, Fiona. Thank you. And I think it's thank you for the opportunity to be online today. And it's really, the research is the most important part of the work. So one of the most significant challenges that we're experiencing at the moment is currently we're responding to the Southeast Queensland events or the flood event, is that cumulative impact of disasters. So multiple events that's taking place. We have communities that have been in drought, we had COVID, then we had floods, then we threw a heat wave in between, and you got fires and then floods again. So that cumulative impact of disasters or natural disasters, when we're supporting communities, is one of the most stressful things for communities at the moment. And we're seeing the impact on the mental health, the impact on the well-being. So certainly we're seeing that. Another big significant impact is population movement, and that changes in the demographic and of population, the displacement. And what we're seeing is the vulnerability indexes in terms of data is actually getting thrown out the window as population move. Now in Queensland, we had the highest population growth as a result of Queensland, of people coming here as a result of COVID. Now, 2/3 of natural disasters take place in Queensland every year. So we have an increase of population to the most disaster-prone state that are living in more vulnerable communities. Vulnerability in terms of the community housing issues, where they can actually affordability of rentals. So this is a challenge. One of the other challenges we're having is also funding cycles. So funding cycles in terms of recovery, investment is always as fixed term service delivery models. Now that doesn't work for community. The impact on community, the impact on climate change, and the impact on mental health is not confined to funding cycles. So there's a challenge in itself. Now, the opportunity in terms of research, and spot on what you said in your introduction, is the evidence-based approach to inform our work, to influence practice is utmost essential. And the more we do this, the better it is in terms of our practice. Now, we're seeing the impact of mental health is a huge opportunity in a changing physical environment as a result of climate change, but also in the changing in the social environment. The social fabric of community is actually changing. So it's where research meets practice. And I think there's a huge research opportunity in that specific area. Now, it's really, really hard to build resilience in a single event. Then we have multiple events taking place. And I think the psychosocial impact in a multi-event community, there's a huge research opportunity there again to look at how can we inform our practice. Now, we're certainly seeing that impact on mental health and, as a result of climate change. And there's a couple of last points I would like to make is around fatigue and fatigue management. Not just community fatigue, but fatigue and tiredness and worry in first responders and people working in the space. Now, we know there's research. We know there's existing research. More research needs to be done in terms of how we're using the research to address the issues of fatigue management in community and in terms of First Nations. I think in First Nations communities, sites of cultural significance is a big issue, especially when there's a loss of important cultural significant sites. Now that has a huge impact on mental health of First Nations communities. So I think more and more research is required in that area. So this is a couple of things that I would like to speak out about, but my time is up, I'm sure. And I would like to finish off monitoring and evaluation frameworks are fantastic. It should inform our work. But within that, having the frameworks in place and having good monitoring and evaluation frameworks is one thing, but research is needed about how do we put it in practice. I think that's a big gap, and I'll pause there. Thank you, Fiona, for the opportunity.
Absolutely. Thank you, Collin. That was fantastic. So yeah, a really broad scope of challenges there, which are the new challenges, as you point out, in some way. We don't quite know what this new space or new experience of multiple events is really going to mean for our communities, other than we know that it's increased adversity. So lots of questions there. Thanks, Collin. Ben, I might throw to you. You've led the Tackling Regional Adversity Through Connected Care, or TRACK program within Queensland Health for several years now. And we're very grateful for all the work that program is doing. Can you tell us a little bit, just briefly, about what that program does for people who might be online and are unsure, and really talk about how solutions-focused research could assist the program in delivering its services?
Sure. Thanks, Fiona. Thanks for the invitation this morning as well. Looking forward to meeting the rest of the network in time. The TRACK program's gone through a few name changes as it's evolved to keep up with the research and the learned kind of experience on the ground. So initially it stood for Tackling Regional Adversity Through Integrated Care, the TRACK program. And it essentially is still about that, but we found that the name was a hard sell for people, in the lay sort of community. So the current name is Tackling Regional Adversity Through Connected Communities, TRACC. Because we found that when communities are connected, a lot of good things happen as well, including integrated care, including improved resilience, etc. So the the track program is based around 4 key ideas. The first is about connecting people to the right level of care at the right time and place. So it's basically integrated care, but in a more easier to explain, sentence, if you like. The second is about working with the community to help them to better understand their own mental health, or what we used to refer to as improving mental health literacy. And the aim of that is really about improving help-seeking sort of behaviour, because that's really important. The third key action area is about working with people who form the informal frontline following a climate risk event. And that frontline potentially could change from one event to the next. But it's typically not your Queensland Health type, services. It's people who are working, it could be your GPs, it could be your local hairdressers, sporting clubs, churches, that sort of thing. So it's working with that sort of cohort of people to help them to identify people who might be dealing with a mental health issue, know how to respond appropriately, and importantly, know where to refer to. So, we can't refer to that in a way as improving referral pathways to the right level of care, etc. And then the fourth one is about, what we used to talk about, improving resilience. What we have found over the years is that the term resilience is a bit of a loaded term. So communities don't like you doing resilience training, with them. It's a bit of an insult. So we unpack that a little bit by talking about working with communities to better deal with their current issues around mental health, and then being better prepared to deal with future events. It is resilience, but in a more kind of explained sort of way. Mm. So it's a multi-level, kind of systemic approach to addressing mental health issues from climate risk events. The track program started way back in 2015, and it was in response to the then Minister Cameron Dick wanting us to do something about the mental health issues of farmers dealing with long-term drought. But we thought that we could do more than just dealing with drought, because regional Queensland, as Collin has alluded to, deals with adversity on a constant sort of basis. So we took a broader kind of adversity approach based to a large degree on a similar model in New South Wales, the Regional Adversity Mental Health Program. Our particular program is a little bit different in that it's got a kind of a more significant clinical edge to it. So we do employ clinicians senior mental health clinicians who can, if required, deliver, mental health treatment in locations where, there are no other clinicians able to access. So in terms of the kinds of things that solutions-focused research could help us with, is really around those sort of key things that I talked about. It's about what are ways of improving that connection to the right level of care, the right time and place. It's about how do we improve help-seeking behaviour? How do we communicate things in a way that removes the stigma associated with seeking mental health? Stigma reduction is an ongoing challenge for us in the mental health sector. And working with the front line, like I said, and improving referral pathways. What we found with the track program is that the more rural and regional you get, the more innovative you need to be with your referral practices. So there's a lot of scope for interesting research in rural and regional Queensland in that space. And then, finally, the point I made about resilience training. or, helping people to become more adaptable, having a more kind of growth-focused mindset. Contrary to popular belief, unfortunately, the more adversity you face, the less resilient you become. So if you do a lot of work around helping people to meet and adapt to those challenges, then you're giving them a chance to become, more resilient. But we are dealing with both an existential and real sort of crisis with regards to climate change. People are now seeing the actual impacts of ongoing climate change year after year. Like Collin said, sometimes multiple times in the same year. But they also know that there's more to come. So that creates a whole level of anxiety and stress, whilst dealing with the actual stress of, dealing with your current kind of impacts. So again, a lot of scope in that space. Yeah. I'll leave it at that. Thanks.
Yeah, thanks, Ben. That's fantastic overview of the program, and also you're really connecting with Collin's comments there about these multiple extreme events. And historically in Australia, we've always we're a country of natural disasters, and communities do recover. But what we're seeing now, as you've both alluded to, are these multiple events on top of each other, and our communities just not having time to rebuild. So we really are in, as you say, in a new era, and need to find some new solutions. So thanks for that really great overview, Ben. Selena, I'm going to pass to you now, because your work with Outback Futures is in some very remote parts of Australia, and that must really provide you with quite a unique perspective on how these remote communities are being impacted by climate change. What do you see as the biggest issue in these remote parts of Australia?
Thanks, Fiona. And again, like Ben and Collin, it's great to be a part of this conversation. Yeah, look, there's so much that I could cover in that answer, but I guess there's a few quick points that I'd like to make just to add a slightly different perspective. I certainly, am in complete agreement with everything that Ben and Collin have said, and relate to it very strongly. But I think so often as we talk about how we can shift thinking and behaviour related to climate change moving forward, we're doing so in groups that are primarily made up of people between the ages of 40 and 60, with the exception of some, but that's the majority. And I think, which means that these same forums and conversations will very likely need to be replicated in 20 years' time with the next generation. So I think there's a real sense for us that we need to be ensuring that young people are a part of these conversations that we're having, so that as we're making discoveries, as we're researching, as we're looking at tools and resources, they're a part of that and can carry that on. I think also we need to be thinking about some of the unseen impacts of climate events and change on our future generations. Both Collin and Ben have talked about, the back-to-back disasters that our communities are experiencing, decades of drought deeply impacting a family and a community on its own, let alone back-to-back with COVID monsoons, flooding, bushfires. I think we can underestimate the amount of trauma that can result in individuals, in parenting teams, and in fact, a whole community experiencing trauma. And when you look at the back-to-back, we've got complex trauma. And I think we often forget the impact that that can have on a child's brain development, on their emotional development, on their learning capacity. So we're not just talking about the visible things, we're talking about the literacy of the next generation that are going to be implementing our climate change research information and responding to it. We're talking about their neural pathways. So I think there's a real urgency to the work we're doing. And I think we need to be focusing on informing our communities about the deeper impacts of climate on their wellbeing and mental health, and equipping them with the tools to at least respond, but to ideally be prepared and forearmed in this space. And so I guess lastly, one of the tools that's been developed by Outback Futures in response to our experience in this area is the wellbeing windmill. So it's a co-designed rural wellbeing framework for individuals. There are lots of wellbeing frameworks around, but a lot of them are very extensive and very detailed. This one's really aimed to be have extreme high utility and to be very relevant and relatable. So we've co-designed it with rural communities. And it's for individuals, groups, and whole communities, helping them to, one, understand the impact of their context on their health and wellbeing, to have a way to measure that in an ongoing way themselves without requiring organisations to come in and lead them in that. And 3, offering them a paradigm for working together to strengthen wellbeing against such challenges as climate change. So, where research fits in, we're currently working, that's come out of our relationship with the Mental Health Climate Change Transdisciplinary Network. That is a mouthful to say. We're actually currently working on a research collaboration with Thriving Kids Queensland and UQ's ISSR to further refine and evaluate this tool to ensure that it has both clinical validity as well as broader community utility, so that there's actually a tool that everyone from the youngest children in the kindergartens and the primary schools, as well as those in the aged care, as well as those on properties and in neighbourhood centres, councils, IGAs, can all be using the same tool and the same 5 factors paradigm to be understanding the impact of mental health on their functioning, their decision making, their children's development, everything in their community, and how to build strategies and tools around that, community-wide, all age and all sector. So yeah, I could keep talking forever, but that's probably a summary for now.
Yeah, that's fabulous. Thank you so much, Selena. And yeah, I'm really pleased that you've highlighted the importance of looking at our child and youth population. They are the ones who are going to be seeing the worst of this, and we really need to be listening to their voices to understand what's going on for them and develop solutions. Thank you so much. It's great to be looking at these, as I mentioned earlier, these populations or parts of communities which might be differentially impacted, and Collin also talked about that when he was talking about our First Nations people. So thank you, Selena, and we are delighted to be partnering with you in some research and very excited to see what lies ahead. Yeah. So speaking of partnering with research, I am now going to introduce you to Dr. Jo Longman. Jo, you live and work in Lismore, so you know on a very deep personal level how our changing climate is impacting communities, and our hearts go out to you and your community members. But you've also been involved in research around the mental health impacts of floods. Can you tell us a bit about this research and how you've been able to engage with communities to find solutions that are of real benefit to them?
Thanks so much, Fiona, and good morning, everybody. It's fantastic to be here, and what amazing other speakers on the panel. Sounds like some fantastic work that's going on, so thank you to previous panel members. So yeah, like Fiona says, I'm actually part of the University of Sydney, but I'm based at a rural research centre in Lismore. Lismore, the most flooded town in Australia, of course, and dealing immediately right now with the after effects of 2 massive floods, one at the end of February and one at the end of March. So we're right in the middle of this. But Fiona's asked me to talk about some research that we did, which was based on the community and how the community was managing in terms of mental health and well-being 6 months after the 2017 floods. So the floods that came to us on the back of Cyclone Debbie. And of course, the research team at the University Centre for Rural Health in Lismore, we're already embedded in that community. We live and work there, and we have all of those kind of networks, and we are part of that community. And I think that's quite an interesting and somewhat unique experience to be so embedded in terms of researching in a particular community. And the work that we did following the 2017 floods was based very much on a strong community academic partnership. So we began that research study right from the get-go with this community academic partnership. So including things like, should we even be doing this research? What should the key research questions be? What should the design be? And the community was intimately involved in all of those decisions and all of that thinking. And those kinds of community academic partnerships have been, you know, really central in other research studies too, to making sure that the gap between evidence and practice is plugged to a certain extent. And in our case, it was almost more fundamental in that we really could not have done the study without the community's involvement. And we had about 60 different key community organisations involved in one way or another. And we actually employed a couple of people from the community who were incredibly well networked for a couple of roles in the research team. So there were a number of ways in which we went about managing that community academic partnership. And I think the benefits of that were really clear to us early on, certainly the relevance of the research questions, being able to pilot what we were thinking about doing. They were integral to recruiting participants, particularly getting to hard to reach groups and supporting and helping people to take part. We did a cross-sectional survey across the community and about 2,500 people took part in that. And it's a brains trust, isn't it? It's bringing people together and using people's knowledge and their networks and their understanding to help design and drive things forward. And it meant that the study was of very direct relevance and of use to the community along the way, as well as towards the end. So in terms of dissemination and translation, it was really evident there that people's connection to the study and their sense of ownership and investment in the study made a big difference to the way we were able to translate the findings for that. And you know, it was the first time really I've had the experience of people in the community reaching back into the research team and asking for specific analyses to be done from the data that we had. And those data have been used extensively to advocate for change and to apply for funding, to inform service planning, those kinds of things. So I think our experience of doing that, and it has shown us also that it's been quite long lasting. So the investment together as a community in that research has stood us in really good stead actually for this current set of catastrophic floods in the Northern Rivers, in that we've already got this kind of network and we've managed to keep that going, and that's been super useful actually right now in this early stage of trying to support the community on the back of these floods.
Yeah, fabulous, Jo. What an amazing example of community engagement you and your research team have done. Just really amazing research and just such a great and important gold standard really for how research should, community-based research should be done. So thank you so much for sharing that, Jo. Last but definitely not least is Dr. Rebecca Patrick. Rebecca is also a very enthusiastic collaborator from Deakin University. And we've got several activities underway, collaborative activities with Deakin. We've got a number of publications, a book chapter. We have dipped our toe in with some pilot work around system dynamics modelling, and then also have an NHMRC ideas grant in to continue to do that work, which will be the focus of another webinar, so we won't go into that in detail. We're also doing some policy research with Rebecca with her CAHA hat on, which is the Climate and Health Alliance. So Rebecca, thanks for joining us today, and thanks for just being such a great ongoing collaborator. What do you see as the value and importance of collaborating with other academic institutions around mental health and climate change?
Thanks, Fiona, and thanks to the network for the invitation. Before answering that, I just would like to acknowledge I'm on Wadawurrung land today and pay my respects. And also an appreciation to our colleagues that are working in frontline organisations on the panel and also in the audience today. And of course, Joe and the communities in Lismore. So I suppose, Fiona, UQ and DU are really, I call it DU, Deakin University for short, really are natural collaborators, academic collaborators. This is probably because we have shared values in co-design, participatory and systems approaches to climate change and mental health research. And Fiona, you mentioned our top 3 points of intersection. Let me just unpack those so people really understand how we work together. Firstly, on climate change, mental health and systems dynamics research, we across UQ and Deakin share capabilities and interests in using group model building, this systems dynamics or system science approach. And also we've developed independently but related technology or software to help us map drivers of climate change among priority populations and communities. And also, importantly, identify priority actions and leverage points for intervention in the community. I suppose together, we're a really great combination of environmental and psychiatric epidemiologists. I didn't even know there was a psychiatric epidemiologist, but that's what Fiona is, and it's been incredible to work with you, Fiona. We've also got health promoters and public health people on our team, psychologists, and as I said, systems scientists. And we're really hoping that our research will be extended through the support of grants at a federal level. Secondly, we've got a really nice publishing routine emerging. We've got a special issue around climate change and mental health, and that also connects in with Joe. Thanks, Joe, for leading us in that space. And we are chipping away at a book chapter for a global health book. And this is where we're looking at, and Fiona, you're laughing, we need to sit down and write that, is we're looking at how climate change and mental health is actually a cross-cutting issue around primary, secondary and tertiary impacts of climate change. And then the third area that we connect over is that intersection of the Climate and Health Alliance's work. I'm the outgoing president, but I'm incoming again. I'm sitting in the president and chair role again for the next few months. And Fiona and UQ and Deakin colleagues, we've been contributing to some policy analysis development piece and a newly established climate change mental health practitioners network. And UQ and Deakin and other researchers have been doing the science which underpin policies such as this one, I'm holding it up for you, the Healthy, Regenerative and Just, which is a framework for national strategy on climate change, health and wellbeing for Australia. And this is evidence-based, so the science that researchers in partnership with community generate inform the policy that we seek to see at federal level. And the good news is Labor has endorsed this framework and has committed to implementing this very policy platform when in power. And hey, they're in power, so that's fabulous news. Just a couple more points, Fiona. We're also collaborating with UTAS and Southern Cross University around outdoor healthcare and nature-based interventions. And I think that's another really important aspect of the climate change mental health equation about nature as a setting for health promotion and that sort of prevention arc of our research. And I'm really looking forward, Fiona and the network, to lining up some of those partnerships and extending our reach. But directly responding to your question about the value of this network and the relationship between our organisations is definitely the coordinated approach to research in this area and the related knowledge translation activities in policy and practice. Of course, the mutually beneficial research activities, importantly, working across the gaps in research, as was what was outlined, Fiona, in your seminal paper that identified the 10 priorities for research in this area. And of course, sharing talent and resources across which is largely an underfunded research area, but hey, I'm hoping for better times ahead. So a really valued relationship between Deakin and UQ. Thanks, Fiona.
Yeah, thanks, Rebecca, and thanks for your, you know, you're such an ally of our network, and we need as many people and partners as we can get in this space. There's just so much work to be done, and also, just as you say, strengthen complementary skill sets, etc. I'll just take this opportunity to remind everyone, if they have any questions, to please pop them in the Q&A. We want to give you the opportunity to ask questions and have them answered by these amazing people that we have on the panel today. It's unlikely that we'll have this group together in another webinar for a while, so please take the opportunity. And we'll get to those as soon as we can. In the meantime, while we're waiting for those questions to come, oh, hang on, there's one question there. Okay, that's around the citation for the infographic. We can do that. Yes, we will do that. I might just come back to you, Ben, because you sat in as part of the development of the National Disaster Mental Health and Wellbeing Framework with the National Mental Health Commission, which took place after the Black Summer bushfires. And there were some discussions, I believe, during that those consultations around how research could support the implementation of this framework. Do you want to have a little bit to say about that?
Sure, thanks, Fiona. So one of the things that came out both in the report and in the discussions of the National Mental Health and Wellbeing Framework was the need for us to be able to develop a national minimum data set that could gauge effectively the impacts of the climate risk event or the disaster on communities. So I'm not only talking about mental health per se, but mental health would be part of that national minimum, data set. So things from a mental health point of view, I think a minimum data set should at least be able to gauge the direct impact of that event on people's mental health and well-being. And you could look at, if you wanted to take it further into a research sort of space, you could break it down into broadly two categories. You could look at things which could have a impact on helping people to recover better, but also things, factors that would impinge or, not help people's, recovery as well. So by that, I'm thinking about things like what sort of factors could enable things like post-traumatic growth, for example. How well placed is this particular community to adapt to, current and future changes, following on from this event. What we need is a simple to administer, but not a simple, if you like, screening tool. So obviously a tool that's got a lot of, good research, behind it, but could be easy to administer, say in those kind of, recovery centers that people like Collin run. And Collin, you and I in the past, we've tried to, in those, recovery hubs and evacuation sort of centers, try to at least get some sort of basic data from people that have been forced to, attend those events, just to get a sense of what the future impact, down the line is going to be. The reason for that is we do get DRFA funding, Category C DRFA funding at the moment for 2 years, although I've argued to extend it to 5 years, in line with the recommendations from the Royal Commission. But we need to base our bid for mental health recovery services on some reasonable data, and at the moment that doesn't quite exist. The sort of data that we do collect, we do, like I said, a simple screening tool. We look at number of people that have received, psychological first aid or referral to another agency. Obviously, impacts of infrastructure, loss of habitat, all of those sorts of things are all captured. But it would be good to have a coherent, organized kind of framework based on evidence, based on research to underpin a data set that we collect, which could then be used, if you like, as a way of forecasting and predicting some sort of, and helping to actually form some kind of, recovery planning.
Yeah, thanks, Ben. And so there's really that important issue that has come up in a number of discussions I've had around what do we measure and how do we measure? What's important in terms of collecting data and how do we go about that? And should it be standardised? Perhaps, there might be some benefit across organisations and different populations of having a standardised, but maybe slightly adaptable for the context measures, so that we can have some comparable data as well, because really without data we don't know which way's up. Colin, I don't know if you have an experience with that you want to add to Ben's comment.
Yeah, thanks, Fiona. And spot on. And working with Ben for many years, we synergize very nicely with each other, what the research, what the practice is. And I think I would bring back to climate change and the impact, and linking it to mental health. And a few years ago, the International Federation of Red Cross issued a report called the Cost of Doing Nothing report. So the difference with this report to all the other climate change report is that it made it a humanitarian issue. So climate change is a humanitarian issue. And what does that mean is that for human beings and the well-being and the psychosocial support and the impact of mental health on climate change is a huge issue. We're seeing that in our recovery centers. We're seeing that in our evacuation centers the moment people come into our care. And we're seeing that for years after that's taking place in community. So outright correlation, making reference to that bringing people to the center of our research is utmost important. And we're seeing this trend now, and it's more and more keeping people at the center of all the research. So why do we rebuild the bridges? Why do we relocating homes? Why do we widening the roads? And all the physical rapid damage assessment data, but keeping people right at the center will have a better advocacy and influence outcome in terms of the research. So that would be my advice, and actually synergizes the work that what Ben has been doing for many years. And I'll make reference to some of the stuff Selena spoke about as well, is that especially in Outback communities, the mental health impact on young people, that cumulative impact, we're seeing those firsthand in recovery centers, in evacuation centers, where very, very clearly the impact on young minds. And I think there's a huge opportunity for research in this area. And how do we influence practice and change?
Thanks, Colin. We have a question here from Caitlin. Climate change can be a contentious topic in rural and remote/agricultural communities. Can anyone speak to the experiences where this has been well received and what strategies have been used?
You want me to take that, Fiona?
Oh, Colin, yeah, go ahead.
Okay, so, and I'll make reference to last year, we issued a report, a drought report, and it has direct impacts on climate change in communities. And Selena was part of that conversations as well. Now, what we're actually seeing is in communities Outback, especially in drought impacted communities, is that the community conversations need to take place. So whether it's a drought impacted community or natural disasters, communities are normally fractured because policy doesn't see drought as a natural disaster. Now, to a community, it's still a disaster. And we're seeing that conversations taking place, that advocacy and influence right down at grassroots levels coming through. And there's some really good evidence of local communities taking action and saying that this is a disaster for us and you need to listen to us. So we're seeing that activity, and I will make reference to the drought report that's Red Cross publicly available that makes direct reference to some good practices taking place at local communities.
Thanks, Collin. Jo, you've got your hand up. You want to go ahead?
Yeah, thanks, Fiona. Yeah, I can just add a bit to what Collin said. So in 2020, we ran a research study across a number of rural communities in New South Wales, where we looked at resilience building. We looked specifically at the resilience to the mental health impacts of climate change. And this topic came up about, well, how do you tackle this in rural communities? And actually, some of the most practical things that people had found helpful were to be really focused on what's happening in that community, not necessarily to have to spend time, labeling it as such, as part of the climate crisis, but saying we can all agree as a community we're currently in a crisis. We're in, we've got a drought, or we've had a flood, or there's been a fire, and how do we come together? And really focusing on what's shared in communities and what can be agreed upon in terms of the future and handling the current situation. So not necessarily getting bogged down in is this climate change or isn't this climate change, but focusing on what can be agreed on and what a community might want for itself in the future, and trying to sort of focus on that. So that was people's way, I think, or one key way that people talked about how you might handle that in a rural community. And there were some discussions about people eventually kind of, coming on board and feeling more comfortable talking about climate change, down the track when those conversations were taking place. So.
Yeah, thanks, Jo. Thanks. I'm conscious of time, so we'll leave it there. Just to let you know what is coming up from the network and its extended family. We will continue this webinar series every 6 to 8 weeks, and we will certainly let you know. Please keep an eye out on our website, but we will be sending out emails, and some of the topics will be around system dynamics modelling that Rebecca and I have alluded to today, talking about climate anxiety and those specific issues that might be in our children and youth, talking about the policy that Rebecca and I have also mentioned today, any policy work, mapping interventions in mental health and climate change, and also looking at it from a social science perspective. They're just some of the proposed topics, so watch this space. And if you would like to join the network, please subscribe to our mailing list on the website if you haven't already. Are you interested in working with us? Please let us know, whether you're from industry or academic space. Let us know if you've got an idea for a research project or a research question and would be interested in working with us. Of course, there are PhD and MPH opportunities. If you're a student or a potential student, please reach out to us. We really want to build capacity in this space, and there are lots of opportunities with potential scholarships, etc., through UQ. For any inquiries at all, please contact Liz Shaw, who is our Research Network Coordinator, on that email address. I want to thank Liz and also Suhaila Ali, who have been working tirelessly in the background for this webinar. I want to thank all the panellists. It's been a fantastic session, and we look forward to connecting again very, very soon.
Thank you.
Thank you.
Thanks, everyone.
See ya. Bye.
Thanks, everyone. Have a great day.